And how long does a typical treatment take? In other words, how long should patients plan to be in the U.S. while they're completing their fertility treatment?
那从中国来的病人在美国要待多久才能够完成这个关键的步骤呢？
So a typical treatment for which a patient must be locally close to where they're getting their treatment done, not just the clinic where they're getting their ultrasounds, but also the lab where they'll eventually have their procedure, really takes about 2 to 3 weeks. For the first week or so, patients are coming into the clinic every other day, maybe every 3 days for ultrasound, blood tests, just to kind of gauge how your treatment is going. But it gets a little bit more frequent in the last week. Patients are coming in almost every day leading up to their egg retrieval.
我们建议病人住在诊所附近哈，当然 RSC 有很多分院，在这个美国停留的长度2到3个星期啊，根据每个人的治疗方案不一样。一开始的话，可能是说每2到3天要去你所在的分院哈去做这个抽血，去做 B 超。那到最后1个星期的时候，可能你要每天都去。
Just to add that probably the most important part of the whole treatment is actually the initial consultation, where the doctor and the patient really talk about the patient's goals, what kind of treatment they would like, whether they want to use pre-implantation genetic testing for doing a genetic testing on the embryo or not. And while that can be done in person at our clinic, it can also be done virtually. So patients can stay at home and not need to worry about traveling for that initial portion. One thing that also is helpful for that initial consultation is if patients have some diagnostic testing done beforehand, maybe some very basic blood work or even an ultrasound to look at their ovaries and see what their ovarian reserve or the number of eggs that they have left in their ovaries is.
我想加上一点，就是刚才讲到的是说你进周期之后看起来是怎么样的。那现在就是说我们叫首次咨询，这个是非常非常重要的。这个可以通过线上哈，像我们今天这样，也可以像本地的病人会面对面的跟医生进行首诊，因为首诊会知道你的这个治疗周期大概是多长。另外就是很多这个提前的检查，你可以在中国做，这样的话节省你在美国停留的时间。